Hello everyone and welcome to this webinar. My name's Professor Lisa Ackley and I'm your chair for today's webinar, looking at how climate opportunities are public health opportunities. This is being presented by Dr. Pedro Beltran Alvarez. Pedro is a senior lecturer at Hull York Medical University, where he's also Programme Director for the MSc in Health and Climate Change. Today, I'm delighted to say we've got around 400 registered participants internationally from many different countries. Before we begin, just have a few points of information for our participants. During the presentation, please do feel free to ask questions as you think of them, and Pedro and I will do our best to answer as many as we can during the Q&A session at the end of the presentation. You can ask questions at any time by typing them into the Q&A box at the bottom of your screen. Do feel free to use the chat for any discussion, networking, but use the Q&A box for any questions so that I know where to look and they don't get lost in the chat. If you have any technical difficulties at any point during the presentation, please outline the problem in the question box and someone from the technical team will try to respond as soon as possible and resolve the issue. Your CPD certificate will be emailed to you after the webinar. And we often get asked, can we have the slides? So I'll just say that the whole recording will be available after the lecture, so that people who are members can gain access to it. So they will be available in that format. I'd like to now introduce our speaker for today's webinar, Dr. Pedro Beltran Alvarez. Dr. Pedro Beltran Alvarez is a senior lecturer in health and climate change at the Hull York Medical School. With over 20 years' experience in multidisciplinary research, his work spans environmental health, mechanisms of environmental adaptation, cancer, and cardiovascular disease. He also provides CPD to greener NHS and to local and regional authorities and organisations. So great delight to pass the baton over to you, Pedro.
Thank you so much, Lisa, for that very, very generous introduction. I used to say that if you Google Pedro Hull, I used to be the first link. Now there is a footballer called Pedro, apparently, playing for Hull City, the local football team. And he's kicked me out quite literally to the second page of the Google search. But hopefully you would still be able to find us. So thank you so much, Liz, and thank you everyone for joining us for this talk with that title about climate opportunities and health opportunities. I would like to highlight from the beginning that I'm certainly not willing to trivialize the climate impacts on health. I'm very concerned we are in terrible trouble around those health impacts of climate change and extreme weather events. There are many resources out there to learn about those impacts. This talk is more about the opportunities related to tackling climate change in a fair and inclusive manner. So that's why I'm focusing, my angle will be the opportunities, but as I say, that's not with an intention to trivialize any of the impacts that we are seeing, that we will be seeing over the next few years and decades around related with climate change. So this is a story that I would like to share with you today. I'm going to begin with discussing some of those impacts and some of those opportunities for global health, taking some of the figures from the Lancet Countdown that was published in October 2024. And then some of the work that we are doing around schools and education around climate and health, some of the opportunities around healthcare systems as well, and some of the work that we are doing in that space. And then, as Lisa said, much of the work that we do is multidisciplinary. So I'm going to bring in some of the opportunities around research and biomedical research and planetary health research at the end. So that's my story. I hope that sounds okay and interesting to everyone. And I'll just start with recommending the Lancet Countdown if you're new to climate and health. the Lancet Countdown is a great place to start. It's published every year, and they cover impacts and exposure and vulnerabilities and adaptation and mitigation, and with that umbrella of the economics and politics and governance. So I'm going to show some of the figures from the Lancet Countdown 2024 and in previous years as well, just to set the context of climate impacts and potentially those climate opportunities that we are talking about. And one of the things that we hear all the time is that climate change is increasing the number of extreme weather events. And the Lancet Countdown has gone and quantified that. So in 2023, 61%, a record high of all land area, had a higher number of extreme precipitation events. And as you can see on the right, the average number of those extreme precipitation events has been increasing over the last few decades or so as well. These are the extreme weather events. They have health impacts. And I'm sure many people will be starting to think about some of health impacts related to flooding, for example. Think about mental health. Another of those extreme weather events can be heat waves. And this figure shows the number of average days where the minimum mortality temperature has been exceeded across the globe. So we will know that temperature and mortality there will be a Goldilocks sweet spot in terms of temperature. If it's too cold, that will lead to excess mortality. If temperature is too high, that will lead to excess deaths. There will be that sweet spot in the middle, and that temperature for minimal mortality can also depend on the country. What the Lancet Countdown has done is produce the data to support those lines of thinking, and that is what you can see on the left. So on the left, you see those red arrows. That is the effect of climate change. So that is the increase in that average number of days that exceed minimum mortality due to climate change. And on the map, you see the number of days where that minimum mortality has been exceeded across the globe. So most of those countries, as you can see, will be in that kind of orange, pale orange, dark orange, brown color, indicating more impacts in those areas. Crucially, the impact is not the same. So there will be vulnerable people like infants and elderly people who can be most exposed and most vulnerable to the health impacts of heat waves. And that is where the opportunities begin to crop up. And we can be able to identify who those vulnerable groups are and then put in some interventions to minimize those impacts and hopefully to reduce those health inequalities. So many of you will be aware that in cities like in Paris, for example, there is a register for heat vulnerability. So residents of Paris can self-identify as vulnerable to heat waves. And then the local authorities can go and do something about that, can distribute funds, for example, or can put in education programs on how to minimize those health impacts of heat waves, as I say, targeting specifically vulnerable groups. Again, the impacts are unequal, and this is again coming from the Lancet Countdown, and it is the labor loss in low Human Development Index countries, medium Human Development Index countries, high Human Development Index, and very high Human Development Index countries. And I think two main messages from these figures and from these stats. One is the hours of labor loss have been increasing over the past few decades, over the last 30, 35 years or so. and that's across the globe, but the impacts are not the same. So in medium human development index countries, for example, that scale in the y-axis is one order of magnitude higher than in the very high human development index countries. So those impacts of heat waves in terms of the labor loss due to heat waves are unequal in depending on that index of development in a country. And that angle of inequalities and that angle of vulnerabilities, I think that's where the opportunities are to try and think about, co-create ideally, interventions to minimize those inequalities, to minimize those impacts and reduce those health inequalities. So let me tell you about some of the work that we are doing around schools in vulnerable places. I'm at the University of Hull, in Kingston upon Hull, and we are the fourth most deprived local authority in England. We are not only most deprived in terms of economically, but we are also very vulnerable to flooding, with a history of catastrophic flooding in the recent past, and to sea level rise, and tide surges and storm surges and extreme weather events. So we are exposed and vulnerable and very deprived as a local society. So one of the opportunities that we have identified is to go to schools and start talking to children, primary school children and secondary school children, about climate, about sustainability, about climate and health issues and solutions to that. So what we have been doing is working with them in small groups, as you can see, and using techniques that they have learned already during the curriculum, so mapping techniques. So we are working with A2 size papers and transparency papers and different colors of pens, and very coached by staff. So small groups, and we've got at least 4 members of staff there, coaching that group of students. And some of them can really get stuck in. So really engaged, really sharing their previous knowledge about sustainability issues in their local context. What we are asking children to do here is to draw the school in the middle of that page. I'm going to show you an example in a minute. And then their way to school. So from their home to school, what do they see in that way to school every day or when they come back? And then we put in a transparency paper on top of that, and we ask them to map out sustainability issues, climate issues related to, or that they see every day in their school, in the way to school. And then another transparency on top, and then what are the solutions they think we should put in to tackle those issues. So things like littering, for example, are very common. Hopefully you can see in the top right there, that's a robot that is supposed to kind of pick up litter from their streets. So we go all the way from the ultra local knowledge about their schools, what are the issues around that, and what are the solutions that children propose to that. And you can imagine that there are some very imaginative solutions. We've got a robot there, but another conversation was about crocodiles, for example, to have crocodiles on the street. I didn't dare asking if that was to eat up the litter or to eat up the people who litter, but that was their idea anyway. So very refreshing, very imaginative ideas from these children. This is how some of those maps look like. So we've got the school there in the middle. As I say, we were asking children to map out how their way to school is and what they see. So if they see green spaces, if they see shops, and then, as I say, bringing on the example of litter again, if they could then link litter to shops, for example, takeaway shops, to litter. So it was really interesting to see how they made those links. This is a transparency that goes on top. So the school is still there in the middle, and we were asking them to capture all those discussions about issues related to climate, sustainability, climate and health, and the solutions that they would put in place to tackle some of those issues. CCTV, that you may be able to see in there, CCTV was quite a popular solution in terms of tackling some of those issues around. Maybe you're able to see that. So there is dog poo and trash. So as I say, CCTV was quite a common thought among our children. And then what we did was to bring children together with academics, policymakers, activists, artists, and we started working on a different type of maps. So those are maps of Hull. So maps of Hull, and using those icons to again map out issues related to climate, to sustainability, to health on specific places in Hull. And we were working all together in the same room to bring, to bring everyone at the same conversation. And this is how those maps look like. So this is a map of Hull. We've got the Humber estuary there, and then in yellow, so all those yellow icons are issues, and all the blue icons are the solutions that children and stakeholders, say, from the private sector, from the public sector, academics, activists, NGOs, we were thinking together about all that. We had a fair representation from all over the city. As you can see, Hull is about 250,000 people. So some of the tables would focus on the area that they were most comfortable with. And then we went hyperlocal. So we had maps of Hull postcodes, and again, encouraging our stakeholders to map out issues and solutions. And then we went into problem solving. So we had those problems, say, for example, air pollution, and we had those solutions that they had identified in their small groups. And we asked children and stakeholders when we should implement that solution and who is responsible for that. So, for example, we had green spaces, solution, more trees. When should that be action, and who is responsible for that action? Low engagement and apathy or awareness, the solution being community-led decision-making and governance. When should that happen, and who is responsible for that? We have different colors for different stakeholders. So say yellow was children, blue was academics, green was policymakers, and different shapes for different priorities. So say circles, months time, squares, midterm, 5 years, triangles, long term, 10 years. And then who is responsible for that? So is that the school, or is that the university, or is that the local authority, or is that us as citizens, or is that our families? So we were, as I said, identifying problem solutions and then an action to tackle those problems and implement some of those solutions that we were co-creating with stakeholders, including children and young people. We ended up doing an exhibition about this. So this was exhibited in the Humber Street Gallery in the Hull Marina for about a couple of weeks. So we had that opportunity to engage with the local communities, with the local public as well. This that you can see there in the middle is an artist's representation of all the maps that we had generated, probably tens, if not hundreds of them. We had an artist kind of collating all that information. So that robot that I showed before will be somewhere around that. And it was a participatory exhibition as well. So again, we had these maps of different postcodes in Hull and encouraging visitors to share their previous knowledge and their experiences with us. Say, problems, solutions. We also had a welcome to the future wall, and we were encouraging children and adults to kind of illustrate how they thought, the future would be. So, imaginative ways to create milk in the future. I think that's some boots with some rockets on them. So really, as I said, really refreshing ideas, but also kind of a lot of food for thought. So this is coming from adults who are asking for more green spaces. Hull becomes an anti-racist community by welcome diversity, and I particularly like that one. So maybe it's just me, but I like to talk more, just hanging out and living together, figuring stuff as we go. There will be challenges, but if we've got each other, we are all right. So it's providing that space, that safe space for everyone to express themselves and co-create some of these opportunities. So we are at the moment analyzing all these data and looking for funding to go to the next level in terms of implementing some of those solutions that children and stakeholders identified. We are already working with Withensea High School. So Withensea is in the East Riding of Yorkshire. It's particularly vulnerable to coastal erosion. So some of the areas in the East Riding of Yorkshire lose between 5 and 10 meters of coastline every single year. And we are working with Withensea High School to again to work with children around that. And that is led by our PhD student Iran, and she's already managed to, in her first year of PhD, she's already managed to win some poster awards. So well done to her. And from the university perspective, we are also offering this Masters in Health and Climate Change. So the Hull is a deprived area, so it's difficult to recruit health professionals, and even more difficult to maintain those health professionals working in Hull. But we are also very vulnerable to climate change impacts. So the idea here is to help health professionals who are interested in sustainability and climate and health impacts realize what are the impacts and what are the opportunities for adaptation, for mitigation of climate impacts, and for adaptation to the climate impacts that are already locked in due to the amount of carbon emissions that we've put in already in the atmosphere. So that is our work around schools, and that is about half of my talk already. So I suggest we do the 20-20-20 every 20 minutes, look at something which is at least 20 meters away for 20 seconds. So I'll give you a few seconds for that. And I'm going to introduce then the next bit of my talk, which is about these healthcare systems and the opportunities around working with those health systems. So this is coming from the Lancet Countdown 2. And what you can see on your y-axis on the left is healthy life expectancy at birth. And then on the horizontal axis, that is the greenhouse gas emissions per capita, per person. So in an ideal world, we would have all the countries, so all those different dots are different countries. We would have all the countries in the top left corner, right? High healthy life expectancy, very low greenhouse gas emissions. That's not the case at the moment, but I think that from these data, the opportunity is clearly that from the 250, 500 mark in terms of kilograms of CO2 equivalent per person, from that mark, hopefully you can see my laser pointer, there are no increases in healthy life expectancy. So countries that have, 2,000 kilos of CO2 equivalent per person don't have a different healthy life expectancy than those that have 250 kilograms of CO2 equivalent per person in terms of greenhouse gas emissions from those healthcare systems. So the opportunity is there to reduce emissions, because we know that that doesn't necessarily have an impact in terms of healthy life expectancy. We have been working around healthcare systems. I'm going to very, very quickly go through a couple of papers. So this has just been accepted in the British Journal of Surgery Open. Here we have calculated the environmental costs of infections after vascular surgery. How do they compare with the severity of those infections and with financial costs? So we found that the more severe an infection is, for example, from no infection to taking antibiotics to intravenous antibiotics to further surgery, the environmental costs and the financial costs go hand by hand. In this piece, we are asking, or we are drawing on health plans from countries in the global south, like India, South Africa, and also Australia, also the UK, for example. So countries with a health plan, and we are arguing that we can adapt those health plans to countries in sub-Saharan Africa. Countries in sub-Saharan Africa, like for example, Nigeria or Ghana, they will be very exposed to heat waves, but sometimes, or many of them, will not have a dedicated health plan that can help prepare and mitigate for some of those impacts of heat waves. So we think that we can learn from existing health plans and existing criticism of those health plans, and then produce local health plans or regional health plans which build on existing infrastructures, governance and healthcare system infrastructures in those countries in sub-Saharan Africa to, as I say, to prevent some of those impacts of heat waves on some of the most vulnerable people. And in this piece, we are arguing that really to be able to build resilience to climate change from a health perspective, we need to work both ways, top down and bottom up. So top down with healthcare systems, identifying how they are adapting to the impacts of climate change. So for example, talking about flooding and mental health impacts, how are those local healthcare systems adapting to the increasing numbers of mental health issues due to climate impacts? And how are communities adapting to that as well? So how are communities adapting to that increased prevalence of mental health issues? Can we learn from those communities which are at the forefront of climate impacts, and can we scale those adaptations up to the regional or national level? So that is what we are arguing in that piece, which will hopefully be published soon. And we have also been working with Alessandro Caruso Architects, who are the designers of this iconic Alam Diabetes Center in Hull. So this opened perhaps 2 or 3 years ago in the Hull Royal Infirmary, so at the very, very center of the city of Hull. We are working with them to try and understand how minoritized communities feel healthcare spaces. So how the lights, how the colors, how the space, how the design of healthcare spaces can be more inclusive and incorporate the learning and the previous experience of minoritized communities think about health, think about refugees and asylum seekers, for example? Can we learn from them to make those healthcare spaces more inclusive? And that is my healthcare systems opportunities as well. I would now like to spend the last 8 minutes or so of this talk presenting some of the work that we are doing, perhaps from that more multidisciplinary perspective, so more biomedical opportunities and more planetary health research opportunities there. So this is the work that we have done, or we are doing, around water pollution and health opportunities there. So we are interested in water pollution, and in particular, water pollution with pharmaceuticals and personal care products. So this is how it works. I'm going to use the example of antidepressants here. In the UK, between 15 and 20% of people, of us, will be taking antidepressants at any given time. And due to depression, for example, or a number of mental health issues. And after a few days, after a few weeks, we metabolize those antidepressants, we excrete those antidepressants in the urine. So that goes to wastewater treatment plants. But wastewater treatment plants are not designed to remove antidepressants or any other pharmaceuticals from the effluent. So that those effluents and those pharmaceuticals, those personal care products, those antidepressants end up in fresh water systems like your favorite local river. So this is a picture of the Humber estuary. So that's the Humber. At the close end, we've got Yorkshire. At the far end, we've got Lincolnshire. And this is the Humber Bridge, which is one of the iconic photographs around Hull. And the water that about 13 million people have used in England will go through the Humber at some point. So there is loads of pharmaceuticals in there, including paracetamol, ibuprofen, metformin, and antidepressants. And we know, it has been known for 20-25 years, that antidepressants have an impact on some of the wildlife in those rivers. So we know that antidepressants at that environmental concentration affect the behavior of fish and invertebrates. So they can be, so boldness can be increased, and sexual behavior can be altered due to exposure to antidepressants, because they are still pharmaceutically active, and all those serotonin signaling pathways are conserved across evolution. But I think that they've been looking at the wrong side. So what we thought when these projects started about 5 years ago was that antidepressants in water could also affect humans, but perhaps not from that behavioral perspective. Perhaps they could affect human skin, because skin is the largest tissue that we have, but also the tissue that is constantly in contact with water. So, we wash our hands after COVID, we wash our hands for 20 seconds, very often during the day, showering, swimming pool activities, but also in rivers, for example, or lakes, recreation activities, hygiene activities in some countries, and especially children, for example, enjoying those outdoor recreation activities in local rivers or local lakes or local water systems. So what we decided to do was to test the hypothesis that skin and skin cells could be affected by exposure to antidepressants. And we are using Prozac here, or fluoxetine, which is one of the most common antidepressants prescribed. So these are experiments with human cells, and I'm going to show you how we do that. So we've got these plates, hopefully you can see that. So we've got these little plates, and we've got human skin cells plated out in this well. So you can see them in blue violet. And maybe you'll be able to see kind of a line that goes across those wells. In this case, a horizontal line, if I put it that way, a vertical line. So that is the scratch. If we look at that scratch under the microscope, this is how it looks like. So we have skin cells in violet, there on your left and on your right. And then we've gone and scratched them using a tip, kind of to simulate a wound, to simulate an injury. So this is how that scratch looks like. This is how that those cells look like after the scratching, after that wounding, if you like. Then we have incubated cells for 36 hours after the scratch. And what do skin cells do after an injury? Well, they try and grow and close that gap, close that wound. And that's exactly what skin cells do in the lab as well. So we've got those skin cells in violet now trying to close that gap, that wound. This is what happens if we expose those skin cells to Prozac, to fluoxetine, for those 36 hours. And I'll take that high concentration of Prozac first. And I'm going to try to convince you that that gap, that wound, is almost closed. When you compare it to that one, that gap is almost closed when we are exposing those cells to environmentally relevant concentrations of Prozac. So this is the concentration of Prozac that you would find in the effluent from a wastewater plant, from a wastewater treatment plant. This is the concentration of Prozac, this low concentration of Prozac. This is what you would find in the Humber or in your local river, especially if it's close to a city. And what we can see is that those cells proliferate further and close those gaps. This is with skin cells in the lab. This is with human skin. So this is skin biopsies that we are taking from surgery, from the hospital, from the local hospital. And now we've got the skin in green, and then we are wounding those skin biopsies. And that is the hole that you can see there in the middle in the form of a chestnut. Okay, so that is the wound, the hole, the injury that we are doing to that skin biopsy. And this is what happens when we incubate those skin biopsies with Prozac. So again, this is the concentration of Prozac in those wastewater treatment plants effluents. And those skin cells are proliferating and closing that injury. And again, that's with low Prozac, the Prozac that you would find in the rivers, that is the case as well. So just to wrap up this bit about water pollution, pollution is widespread and there are loads of pharmaceuticals in there, and we don't know what the impacts of that pollution is. We think that environmentally relevant concentrations of Prozac promote wound healing, and potentially there could be an opportunity there to repurpose Prozac for chronic wound healing. But there is another opportunity there, and we are working at the moment with the East Riding of Yorkshire Council around this to see how green social prescribing can be used to reduce the number of antidepressant prescriptions. And I'm very conscious of time, so I'll quickly go through the last bit of my talk, which is this planetary health opportunities. So planetary health will be the health of everything on the planet, really. So the health of our health, of course, individually, and public health, global health, the health of all the animals that live with us, but also the health of the oceans, the air, the wild animals, the populations of wildlife living all around the planet. And we have been working to understand what the effects of heat waves and radiation are on embryology using zebrafish as a model example. So across the year, we've published a number of papers looking at how thermal stress can affect zebrafish embryos, how that stress is propagated, and how thermal stress can potentially protect against radiation stress. So I'll go very quickly through this and just pinpoint the most important points. We know that thermal stress can affect embryos. That has been known for many years. What we are interested in is to understand how embryos that have not been exposed to thermal stress can be affected by that stress propagation. So these are embryos that have not been exposed to heat waves, but still they have altered growth and altered behavior when we expose them to the water, to the media, where these embryos that have been exposed to thermal stress have been. We then investigated what are the metabolites that are there, what's in the water that is driving that altered behavior and that altered growth in embryos that have not been themselves exposed to thermal stress. So we have identified the pathways, the metabolites, and the pathways that drive those phenotypes. And we also know that thermal stress can actually protect from exposure to radiation. So just mild thermal stress can have some benefits in terms of protecting from radiation stress. But when you combine thermal stress with those stress metabolites, then we go into that adverse zone. And then we start to see those mutant phenotypes in zebrafish embryos. So that is with zebrafish in the lab. We have also been working with wildlife populations out there, particularly thinking about lizards. And again, we've published a few papers over the past few years. And Lisa, we were talking about the Canary Islands yesterday, didn't we? So we have been working with Tenerife lizards in the Canary Islands and collecting tips from these lizards, so minimal intrusive sample collection there, and investigating how the proteins that are expressed in those tips of the tips and how the genes are adapting to environmental change. So Tenerife in the Canary Islands have these 4 environments. So it's humid and cool in the north, dry in the south, but also there is that El Teide peak, which is the highest point in the whole of Spain at 3,715 meters above sea level. And these lizards are able to adapt to all that, to all those different environments, including that altitude gradient. And we are interested in investigating how they can adapt. I'm not going to go into the details. This is all published. But essentially what we are seeing is evolution in real time. So we think that the heat wave of 2017, for example, affected the genes, how genes are regulating the gene expression in animals in 2022, one generation after that exposure to heat waves. So I'll close here just with a quick recap. So how are climate opportunities, public health opportunities again? I'm a big believer that if we tackle climate change in a fair and inclusive manner, we can tackle health inequalities as well. Schools can be one of those opportunities. And I think it's been a great and very rewarding experience to co-create with children and with young people, thinking about those vulnerabilities as well. Healthcare systems and opportunities they're in, they can do more for less. And we've seen that relation between health expectancy and emissions. And there are opportunities there to co-create as well. So for example, heat health plans with communities. There are opportunities around research, around water pollution, and there are opportunities there about planetary health as well. We are not alone. And what has been really useful to us is to have this Masters in Health and Climate Change as that framework, as that structure that helps coalesce interests from within the university and within the local, but also regional and national environment, people interested in climate and health. And having the Masters has been really helpful to enable that the projects are sustainable over time. Yes, we go in and out, but the Masters stay, and we have students working on those projects every year. So we are going to keep going to schools, for example, and engaging with those communities. So just my final slide. What can I do then as a public health professional? Health professionals are trusted voices. I don't like the word leader because that often has connotations of very strong, very laser focused. They cannot say, I don't know. There has to be a very strong vision. I like better role model. I think health professionals can be those role models, and then other people will follow. If you don't know where to start with the Lancet Countdown. There are many things that we can do. And I'm going to recommend everyone to watch those Real Zero podcasts with the great Professor Hugh Montgomery from UCL, with very tangible actions that we all can do in half an hour, in 1 hour this evening around climate change. We have also produced some materials, and I'm including the link there, trying to understand more about the health impacts and also about those health opportunities. Education and awareness, I think, is key in this era of disinformation. Consider CPD. We offer it. Many local regional universities will offer it. I know that Lisa is going to tell us about what the Royal Society for Public Health is offering as well. And do reach out to us, to anyone in those with those interests. So looking forward to hearing more from you. Thank you ever so much for joining me and for joining us. Back to you, Lisa. Thank you.
Just waiting. Great, thank you very much, Pedro. That was really, really interesting. We've got a number of questions to ask of you. One I think that I'd like to deal with first is the example of the school's workshop process. One of the questions is that this was really good. Is it written up anywhere so that other people could trial this locally with other schools and groups? Is that part of your point number three there, or is there somewhere else people can go to?
So that is in the process of being published. So yeah, it's not there at the moment, but it will be there hopefully over the next few months.
Okay, that's brilliant. So where would they go to check whether it's available, Pedro?
Do reach out if you're interested. Super happy to collaborate. As I say, we are already working on the next level with those schools and with others. So please do reach out. You've got my email on the screen. Do reach out, and I can tell you more about that.
Fabulous. Thank you very much. Now, someone's asked, I think we get asked this question quite a lot actually, but could reducing the consumption of meat for those whose health, personal, economic circumstances allow help to mitigate the effects of climate change?
So we often say that the two low-hanging fruits there are healthier, more sustainable diets and increased physical exercise. The problem is, of course, that we have been saying exercise and diet, exercise and diet, exercise and diet for many, many decades. But now we think that with this angle of diets can be both a mitigation strategy, but also an adaptation strategy to climate change. We think that can be a powerful message. So there are a number of studies out there, and the evidence is absolutely crystal clear that reducing the consumption of meat is good for you and good for the environment. There are, of course, other considerations, and I personally think that it is much better to bring people with us rather than to impose anything on them. So, my advice would be, if you can reduce meat consumption, do that if you can. Plant-based is better for you, better for the environment. If you really feel, like having some meat, it may be better to have chicken or pork rather than beef or lamb, for example, simply because of the amount of carbon emissions that are related with those types of meat. So it is that balance. It is about being sensible and about being aware of those opportunities. There are many resources out there. And again, if you reach out, I would be happy to share some with you. I hope that helps, Lisa.
Thank you. That's excellent. Thank you for that. We've got a question here about what initiatives have residents, especially those from coastal communities, suggested to support their mental health, well-being and psychological resilience to climate change impacts?
That's a great question, and you will be aware of multi-million projects going on at the moment, funded by the government in the UK, by DEFRA, managed by the Environment Agency. So there are literally 200 million investment in local initiatives. For example, the Changing Coasts East Riding Initiative, which is managed by the East Riding of Yorkshire Council. And that's precisely what they are doing. Coastal communities are some of the most deprived and some of the most vulnerable to those climate impacts, nonetheless due to coastal erosion. And you're absolutely right. There are huge opportunities there to engage with those communities and to reduce those health inequalities. This is absolutely ongoing, and we are also playing in that field. But again, I'm not aware of any huge publications in that respect yet. We should expect some in the next few months and years.
Thank you. And still on the theme of mental health, is there any mental health support available to researchers involved in this climate change work?
That's a really good point. The honest answer is I don't know, but that's a really, really good point. My advice would be there will be a local resilience forum where you are. There will be a committee around climate adaptation or climate mitigation where you are. And certainly where I am in Yorkshire, there is the Yorkshire and Humber Climate Commission, and we've had some conversations around that among ourselves to try and support each other, because as I said at the very, very beginning, it's a mistake to trivialize the impacts. So I totally emphasize with you, and I think it is important to share, those feelings within those local fora. So that's where I would go.
I was just wondering, actually, as an adjunct to that, whether there might be any implications for the children who are getting involved in the climate change debates as well. I mean, do the schools provide any support for them if they start to get very anxious about it?
That's a really good point, Lisa. You're absolutely right. And that is some conversations that we've had with schools and with local authorities and the NHS around that. You're absolutely right. And with head teachers, of course. So our approach has been, again, to focus on those opportunities, to discuss the impacts, but then focus on those opportunities and things that we all can do. And again, you've got on the screen things that we all can do in half an hour, 1 hour of your time this evening or over the weekend. So that has been our approach. We think that the mental health effects, if any, of talking about climate and health are positive rather than negative. That can help release some of that climate anxiety. And we know that children and young people can have very high levels of climate anxiety. We think that those conversations help simply because of the fact of sharing those anxieties. That already helps. And as I said, at some point, we are working in really small groups. So it's 3 or 4 children maximum per member of staff. So we can help drive those conversations, and we can help support anything that comes up in terms of, you know, any mental health concerns with vulnerable people as children.
Mhm. Good, good. And I guess the children, if you know, if they're given pointers about what they can do in their immediate environment, gives them a feeling of sort of ownership and ability to affect change. So that's very positive.
That's right. That's what we've tried to do with those co-creation strategies, you know, bringing them in the same room with people high up in the local authority, where they are, so that they feel, and it is true, that their voices are heard by policymakers in their cities.
Well, I think it's going to be really interesting when you write this up and publish it so that we can get to see the detail of it. I've got one final question here from someone who wants to understand that we need to get the schools and younger, she understands the need to get the schools and younger generation involved, but this is a huge responsibility. What are we doing to inform those who are in the position of power to challenge the way we deal with climate change in the health service and government bodies?
Yes, I mean that's the 1 million question, isn't it? And I'm afraid I don't have a straight answer to that one, because it's just so difficult, and that is the complexity here. It's just so difficult and the implications are just massive at many different levels in many different systems. And that is why we need to work together. So we need to be in the same room, in the same forum, with all these different stakeholders, and including their voices to try and find that common ground. We all agree on this. We all agree on this problem. We all agree on this solution. Can we agree on who's responsible? What is the timeline? That is the key of action, really. The other thing that I would say is many of these conversations, I think, need to be place-based, because what works here in Hull, it may not work where you are. So establishing those links with local communities, local schools, local stakeholders, and then identifying those problems, those solutions that work for us here. And then our work, I guess, in the universities, in academia, is to then build up and see what can be scaled up to, you know, regionally, nationally. But it needs to go step by step, I think.
Okay, well, we're running out of time, Pedro. And of course, I think one of the things with all the research that you're doing is that is only going to help to get people to listen. So we've come to the end of the webinar. Many thanks to you and to everyone listening and asking such excellent questions. We're going to have a recording of this webinar available shortly on the RSPH members area. So you might think about joining the RSPH in order to access the recording at any time. And it's very good value for money. And you can, of course, access all the other webinars that we've had at your own convenience. You might also be interested to learn this exciting news that RSPH will be launching a Level 2 award in supporting climate change behaviour change in May, following a successful pilot training, actually training climate champions hosted by Westminster City Council and the Paddington Development Trust. So this is the first regulated qualification looking at the relationship between health and climate change, and gives learners the skills and knowledge to support others to make changes to their daily activities that support greener and healthier lifestyles. So fantastic initiative. I really urge you to have a look at that. Also, I would mention that there's a special edition of Perspectives in Public Health on Climate Change and Health, for which Pedro and I are joint editors, and it's coming out in autumn later this year. So thank you again very much for listening, and have a good rest of the day.
Thank you, Lisa. Thank you, everyone.